Eating disorders, like what are the names of the eating disorders first? Anorexia nervosa, bulimia nervosa, and binge eating disorders. These are part of eating disorders. So the first thing is, how do you recognize that the patient is going through any eating disorder? And how do you differentiate? How can you recognize the eating disorder? Firstly, in anorexia nervosa, there are two types: restrictive type and binging and purging type. But the main difference between anorexia nervosa and bulimia nervosa is BMI, where bulimia nervosa has normal to high BMI, anorexia has low BMI. How do you differentiate between bulimia nervosa and binge eating disorder? In bulimia nervosa, there are inappropriate compensatory behaviors like severe exercise, purging, vomiting, like it is affecting the person, and excessive worry. Whereas in binge eating disorder, there might be compensatory mechanisms, but not like in bulimia. No proper compensatory mechanisms. There is lack of control during eating. Then how do you treat a stable anorexia nervosa patient? First line is nutritional rehabilitation. If no response, or if it is severe or refractory, you give olanzapine. Whereas in bulimia nervosa, nutritional rehabilitation in combination with SSRI, fluoxetine. And binge eating disorder, CBT, behavioral weight loss therapy, SSRIs, lisdexamfetamine, topiramate. SSRIs like sertraline. Coming to anorexia nervosa, when do you ask the patient to get admitted? Like if the patient is presenting with hypothermia, like heat intolerance, and when you check the vitals are like bradycardia, dysrhythmia, hypotension. If there is any electrolyte disturbances like low potassium, low chloride, and any metabolic alkalosis due to repeated vomitings, and BMI less than 15, then these are the danger signs for the anorexia nervosa patient to get admitted to hospital. And what do you do means, we administer fluids, electrolytes, etc. The dermatological complications of anorexia nervosa: patient with hair loss, lanigo hair, osteoporosis, amenorrhea, and binging and purge type, parotid gland enlargement. In vitals, decreased blood pressure, decreased heart rate, and hypothermia. Whereas in cardiac atrophy and arrhythmias. What antidepressant is contraindicated in eating disorders and why? Bupropion is contraindicated. The reason is it decreases the threshold of seizures and increases the seizures occurrence in these people. How do you differentiate bulimia nervosa and binge eating disorder? Bulimia nervosa has compensatory mechanisms like severe exercise, whereas in binge eating, the patient just fears, but no compensatory mechanism is seen as such, and there is no control on food. How do you treat bulimia nervosa? Fluoxetine. Labs in patient on bulimia nervosa: metabolic alkalosis. How do you differentiate between binge purge type anorexia, bulimia nervosa, BMI? How do you treat binge eating disorder? CBT, psychotherapy, lisdexamfetamine, and anti-epileptic. What is refeeding syndrome? When a chronic malnourished patient is given glucose or fluids, there is a sudden shift to anabolic state which is insulin mediated and causes electrolyte abnormalities like hypophosphatemia, hypomagnesemia, hypokalemia, and fluid retention. And the patient presents with edema, arrhythmia, ataxia, and seizures. What happens to RAS in bulimia nervosa? Induced vomiting causes dehydration and volume depression, which causes secondary hyperaldosteronism, peripheral edema. Volume depletion leads to dizziness, orthostatus. Subconjunctival hemorrhage with repeated induced vomiting. Then how do you questionnaire means? Do you make yourself sick? And no control over food, or loss of 1 stone means 14 pounds of weight in last 3 months. Do you feel yourself fat when others doesn't think so? Do you think food is taking biggest control over your life? If yes, for this questionnaire, then you check for extent of disordered eating, maladaptive responses like serum amylase correlation frequency with the frequency of vomitings. Recommendations are nutritional rehabilitation and OP for outpatient follow-up. What are the risk factors? In whom do you ask for eating disorders? Means adolescent females in LGBTQ positive, psychiatric patients with ADHD, OCD, and anxiety disorders. Psychosocial means body image, teasing in young childhood sexual trauma, high pressure, career or sport. What are the medical signs means? Endocrine depression like amenorrhea, osteoporosis, vomitings, dental erosion, salivary gland erosion, subconjunctival hemorrhage, face, large cheeks, palatal enlarged parotids, skin has dry skin, hair loss and lanico hair, GI fluid loss with hypokalemia, cramps, hypoclonemia, metabolic alkalosis,